Shadow Health Secretary is with us this morning. Victoria Atkins, of course, good to see you. Thanks for taking the time. The NHS, we're told, in this report by Lord Darzi, is in dire straits, and it's all your fault.
Well, first of all, of course, I want to have a constructive conversation about the NHS. We all know that the NHS is struggling with some of the pressures that we see in our society, including the fact that we're all living longer. We're living longer with more multiple conditions. That's putting pressure on the NHS, but also wider societal pressures, such as the impact of social media on the development of some young minds. All of these things, I was working with the Secretary of State, and I was clear that I wanted to reform our NHS to make it faster, simpler and fairer. The way that we do that is to marry reform with investment. And so we published the long-term workforce plan. We were putting that in place. It's about training the workforce of the future, fully funded, created with NHS England to ensure that it meets the needs of the system, but also the productivity plan, which I secured at budget this year, £3.5 billion to update the technology on the front line, to expand the NHS app, which 3 out of 4 of us have on our phones already, and also to use new technology such as voice-activated AI. All of these are meaningful reforms that will have a huge impact on productivity, and I'm very, very concerned by the Labour government's first steps, because not only have they given a budget-busting pay rise to junior doctors with no productivity reform, I'm hearing also that they plan to cancel the productivity plan. We don't know what they're going to do with the long-term workforce plan, and indeed I'm also hearing that they're planning to cancel the new hostels programme, which I was pushing through as well as Secretary of State.
The most austere decade since the NHS was founded in the 2010s.
Well, today, the NHS will look after 1.6 million people. And in fact, the NHS is looking after 25% more people than it was when we inherited it in 2010. And so there is across the decade, we know in our own lives just how much life has changed. The same is true of the NHS. And so I'm concerned that Labour are looking backwards when they should be looking forwards as to how we can help improve the NHS. And the other worry I have is that the one part of Great Britain that has the worst outcomes on pretty much every measure is Wales. People are waiting on average 7 weeks longer there than they are in England. 1 in 4 of the population are on an NHS waiting list. And yet we know that the NHS in Wales has been run by Labour for 25 years. If Labour want to have a proper conversation about improving health outcomes for all of our citizens, then I do not understand why they haven't included Wales in this review. But putting devolution, to one side, because we should all be caring about
patients. But we are where we are, and you've run the health service in England for the past 14 years, including implementing the 2012 Health and Social Care Act, described in the report as a calamity without international precedent.
Again, the puzzlement of that is that I'm told, I wasn't in Parliament at the time, but I'm told that Lord Darzi supported those reforms at the time. And interestingly, those Lansley reforms were not implemented in Wales because health is devolved in Wales. And yet we know the outcomes in Wales are so much worse than they are in England. And so you'll appreciate this is 63 pages of a report. We're working our way through it. We will look at it very constructively because I want the NHS to thrive.
Put together in 8 weeks?
I'm surprised. Well, I am surprised it's been put together quite so quickly. We, of course, will want to examine the sources of information that they have used in this report. We know that there are a lot of very, very open data sets. We're one of the most open democracies in the world. A lot of this NHS data has been available for many years. I don't understand why this was not done by the opposition, given that it was led by a former Labour health minister and former Labour peer. I don't understand why they didn't
also work for the Conservative government.
Why they did this in opposition, and so they could come to the country with a plan in their manifesto that we could all judge them on.
As far as Lord Darzi is concerned, he's had 30 years of experience. He's worked for you, he's worked for the government, and he says he's still shocked by the findings. Is there any level of embarrassment for you there?
So I have enormous respect for Lord Darzi. He and I mean, we have worked together on things such as patient safety. He did a lot of work with one of my predecessors, Jeremy Hunt, on patient safety, and in fairness, he's acknowledged that in his report. But I have never shied away, Kay. You know, when I've come on your programme, I've always said, look, that of course there are issues in the NHS. I've never shied away from that. What we've got to try and do is shape the NHS so that it is meeting the expectations and the need that we have today, as well as in the future. And this is why I don't understand there's been such a historical look in this report, because actually we know that we're treating, as I say, 25% more people today than we were in 2010. We know that we have some 11 million more diagnostic tests with procedures each year. We have tens of millions of more outpatient appointments each year. So it's like comparing apples and pears.
Yeah, but the dial hasn't moved on diagnosing cancer in stage 1 and 2. That can't be right.
It has. I mean, this is very, very difficult, and I fully accept we wanted to get even further on the progress that we had made. We know that the pandemic had a terrible impact on us all, but of course it also had an impact, sadly, on people who were obeying the rules, doing what they were told by the
and
time.
And the NHS wasn't in a fit state to cope with the pandemic, is what the report
and that's
says.
the other mystery, is that we know just what a shock the pandemic was to the NHS. You know, we remember our television screens of Sky reporters and others reporting on what was going on. It was such a shock to the pandemic, to the NHS. It's had a long-term impact on staff morale, and some people have left as a consequence. So the NHS has had to pick itself up after that pandemic. And that's why I'm a little bit surprised that I think some 5 pages were devoted to that and the impact of that pandemic in the whole of this 163-page report, because to my mind it was the biggest event in the NHS.
No, what the report is saying is the NHS was not in a fit state before the pandemic, so as a result it was hit particularly hard.
Well, again, when we look at for example, the productivity measure, because that's how we can measure how well the system is working, processes are working, how many patients are being treated. We know that productivity was improving by just under 2% a year before the pandemic. Understandably, everybody, it was all hands on deck during the pandemic. And it's since then we've been trying to raise productivity back to 2% to try to help make sure that we're securing those cancer diagnoses more quickly.
How can the pandemic have impacted on the diagnosis of cancer in stages 1 and 2?
Because we had an enormous surge in demand after the pandemic. So during the pandemic, people stayed at home with symptoms that perhaps they would have gone to the GP with. And by the way, this is because you can imagine I asked this question repeatedly of my very, very highly experienced expert advisors. And because people stayed at home, completely understandably, it then had a massive knock-on effect on later down the chain, with people presenting at hospital with more advanced symptoms and the impact of that in terms of treatment and their survival. I should also say, because I'm conscious there'll be people watching at home who are awaiting either a diagnosis or are in the middle of treatment. You know, the NHS is looking after people as well as it can, and we know that our survival rates for cancer are the highest they've ever been. Of course, we all want them to be even better, but please, nobody at home should be put off from coming into hospital or coming in to get something checked out, because, as I say, the NHS is here, it's open. I'm not the Secretary of State anymore, but I'm really keen to encourage people to come into the NHS to get their healthcare and to help the NHS thrive, because we all want that. And what I'm concerned about, the way that this report has been used by Labour in recent days, trailing it out, trying to get headlines. In fact, I think everybody at home wants a proper conversation about what we do with the NHS. I was trying to do that as Secretary of State through the productivity plan, through the long-term workforce plan, through the new hospitals programme. I will happily work with this government, but I cannot. This sort of trailing and chasing of headlines is not a constructive.
Your government never did that, did they? Never.
Not. Okay, sorry, I've just touched my head. I tried to take the politics out of the NHS.
Maybe you, but not everybody.
I tried.
Not everybody. Why is James Cleverly such a threat to Robert Jenrick?
Gosh, that's a handbrake turn.
That's what I do.
I think they are both great candidates, and they're both dear friends as well. And if either of them win, I will be delighted. I think they both offer they've got real strengths. They offer very real I I'm backing Rob because having worked with him...
Bobby J, apparently, as he's known.
I've never called him that. But
reassuring.
But I've worked with him. We did a lot of work together when I was taking the Domestic Abuse Act through the House of Parliament. He was the Community Secretary at the time.
Is that a new photo shoot? Look at that. Did you see that?
I did. I was sorry. I was concentrating on you. I did a lot of work with him on that. I think he's got some really interesting ideas as well about younger generations. I'm going to look away from you. I mean, they're a handsome lot, aren't they? Gosh, look at that.
You can only choose one winner, though.
But I will be delighted. I think all 4 candidates have real strengths, and I'll be delighted to support any of them.
Always a pleasure to see you. Thank you very much indeed. Thank you.